Good morning. TGIF, I think, do we know what day it is anymore? In the middle of COVID, in the middle of social upheaval. It's summer. I have a hard time keeping track of what day it is, but I do think it's Friday. And for those of you who've been working the 9 to 5, Monday to Friday, congratulations. For the rest of you, it's another day. And I hope you're having a good one. For those of you who are tuned in this morning and not listening on the podcast later, I want to give a shout out to CymaSpace. They're helping us with captions this morning. CymaSpace is an innovative Portland-based nonprofit with a mission of making arts and cultural events accessible and inclusive to the deaf and hard of hearing. And I'm very happy to support them and very happy for their help in making this live stream accessible. So thank you to CymaSpace and thank you to our captioner this morning, Joanna. Sorry, something popped up on my screen again. Speaking of inclusion, can we start over, Chris? I guess I'm not gonna. Did you lost me?
No, you're here.
Oh, am I? So I'm getting some weird messages. Well, I apologize for that. Technology. Speaking of inclusion, I would love to include you in this conversation if you're watching live. Please feel free to join the conversation this morning by commenting on this video. Your comments will come straight to my team, and I'd be happy to incorporate them into the conversation. If you're watching later or listening to the podcast, you can always email us at ourportland@sarah2020.com. And today, I am so excited to have who might be my favorite neighbor, and I have a lot of really amazing neighbors. So this is an exceptional accomplishment, but also I say this a lot because people call me a smarty pants, and this is by far the smartest person I know. Alexis Dinno. Dr. Dinno is an associate professor at the OHSU-PSU School of Public Health and directs the PhD in community health there. She has taught me so much about why we need to be centering public health in our thinking about cities, in our thinking about public policy, and as a tool in terms of how we are going to solve some of the most pressing problems of our day. So this is going to be a fun conversation, but it's also going to have some serious implications in terms of how we need to change our thinking to address the current situation. Dr. Dinno, good morning.
Good morning, Sarah.
Thanks for being here.
Absolutely.
I remember, I think I may be one of the first people to meet you before you moved to Portland.
That's right. You showed up at my job interview and along with a few other people whose names I recall, and were part of a very warm welcome as I transitioned from California in the San Francisco Bay Area to Portland, Oregon.
Yeah, former dean of the College of Urban and Public Affairs, Larry Wallach, was there at the time. That was a very insightful hire on his part, I thought, because you were bringing such a radical perspective to such basic situations in the urban environment. Then, when did you come to Portland? I don't remember what year you got here.
I started in the fall of 2009.
Wow.
And I would have to say I am in good company, I feel, at the both in terms of my colleagues of the former School of Community Health in the College of Urban and Public Affairs, which is now transitioned to being part of the OHSU-PSU School of Public Health.
Yeah, that's some amazing work they've done there in the intervening decade, and hiring faculty like you, I think, was a big part of that. I'm really proud to have watched that over the years move from more traditional frameworks of thinking to some of the more progressive and, just really community-oriented work that they've been doing. Not that they haven't always been community-oriented, but making sure that we're really moving forward. Bangsberg, is that your dean at the?
That's right, David Bangsberg is the dean there.
Yeah, people talk so warmly about him, so you're lucky to have leadership like that where you are. Well, what brought us to this conversation, apart from how come your tomatoes are always better than mine, I feel like a gardening failure next to you because your plants are so robust. Was this op-ed that you wrote back in 23? It was a letter to the editor in the American Journal of Public Health asking, do riot police serve public health? And you were writing this in the wake of Occupy Wall Street.
That's right.
And talk to us about why you thought we needed to bring a public health lens to these protests, I'm just going to use that word writ large, protests at that point, and how
Yeah,
I'll start there.
absolutely. So I wrote that letter to the editor at about the 1 year mark after Occupy Wall Street began. And what I had really landed with me, aside from the important framing of the 99%, and of course the 99.9 and the 99.99%, was that the mayors in cities with really egregious crackdown policies against the occupiers. Mayor Adams, then Mayor Adams here of Portland, Oregon, Mayor Kwan of Oakland, California, Mayor Bloomberg of New York City were invoking rhetoric of public health and safety in the need to shoot protesters, in the need to kettle protesters, in the need to uh, uh, tear gas folks and steal their belongings, disrupt their libraries, destroy their food service provision infrastructure. And if anyone who spent time in the Occupy camps or in similar protest camps since then knows that the people who really take a hand in organizing these events they're building infrastructure. They have got some serious skills in creating community resilience, feeding people, meeting their needs, providing them some basic medical care, via street medics, and providing internet connectivity, providing resources, really bringing some life to the protests, not simply showing up with signs and standing around like a bunch of isolated units, but creating community. And the police response was, as it so often is, was violence. It was, riot police or rioting police is not a very fine distinction between those two things. And as a public health professional, I thought, who the hell are these mayors to usurp the prerogatives of public health, which is to protect the health and safety of the people, not to send them to the hospital with skull fractures, not to steal them and dispossess them.
So now here we are, so many years later, and we're looking out at the streets of Portland. We're looking out at the community aid organizations out there feeding people, helping people who are experiencing homelessness, helping protesters, street medics, being tear gassed, being shot with less lethal munitions, ostensibly. And again, they talk about public safety. Why do you think that policing needs to be considered through a public health policy lens?
Yeah, it's a great question, and I should have even addressed that in what I just talked about. Um, Policing as a public health problem, as a public health issue, had been addressed a decade ago, had been addressed a little bit by the scholars, by the public health scholars, but not a lot. However, over the intervening decade, especially with the growth of the movement for Black Lives, and leaving aside the 2020 visibility and presence, which has also had I think, brought a great deal of attention nationally and at a lot of levels. Um, there were things like police violence databases and more discussion amongst public health professionals that we should be teaching police violence and other forms of state violence specifically as public health problems. For example, California's history of forced and coerced sterilizations of female incarcerated persons. As another example of a public health issue in state violence. But we've been slow to wake as a profession. And so I think what we have to understand is that health comes from somewhere, right? The world is the way it is. Our mortality rates, our COVID rates, our rates of trauma, our rates of being sick and of being well are the way they are, not by fiat, not by, just because that's just the way it is, but because they got to be that way. And they got to be that way because of the way we're making our society. And the way we've been making the part of our society that's characterized by police is by policies from the municipal level all the way up to Supreme Court rulings that privilege individuals who work in the police and the police as an institution with impunity, more or less, to ride over the rights and the health of people, of the populace, of the people. And that has led to, as we've all seen, an increasing militarization. It's led to an epidemic of police violence, and especially directed against communities of color and against poorer communities. And so, yeah, public health and policing, these things need to be, the former needs to be looking at the latter.
It seems so common sense, right? That we would look at this. But when you talk about public safety, and I released that Rethinking Public Safety plan, community wellness and health outcomes, and just even who's being killed and who's not in Portland, does not factor into our police budget at this point. Mm-hmm. I talk a lot about traffic deaths. We lost our neighbor Lou last July to traffic violence. And that death doesn't factor into accountings of expenditures, right, through a public health lens, barely through Vision Zero. And so what are we thinking about, even what we're measuring and what we're counting, when we're putting public dollars behind solutions, right?
Yeah, I have to confess, I haven't read your platform yet. So that's homework I need to get on. But I would like to see personally a reprioritization of municipal dollars that are currently, going into policing and into things like settlements, settling out of court payments to people who've been wronged by the police, which is a large amount of money, just that portion in and of itself. But I would like to see us, reprioritizing away from sweeping houseless individuals off the street and off of encampments and into services, for example.
Yeah.
Providing
it's a huge
food,
part of it. Mm-hmm.
Taking a punitive approach and a policing approach is not going to make for a healthier society the way, say, investment in Housing First would, say the way investing in sort of a neighborhood orientation towards food services and care services, mental health services, providing those opportunities for folks who are the most vulnerable in our city to get the help that they need and the encouragement they need to get along and to have the best quality of life they can.
Yeah, that's really at the crux of what we're trying to accomplish. I mean, for those of you who are watching today live with us right now, please keep an eye on what's happening out in St. John's and John Barnes Landing. They were posted with a 24-hour sweeps notice. We've got about 70 to 75 people residing there. They have food service, they have sanitation services, they have created a community to survive COVID. And we're absolutely playing with fire in terms of sweeping people in the middle of a pandemic. And right before we went on, I said, we're doing all of this in the middle of a pandemic. And you said 2 pandemics. What did you mean when you correct? So talk about that a little bit.
I mean, I could talk about more, but we've certainly got the reality of COVID, which we are all unprepared for, and which our country's commitment to neoliberal capitalism has certainly produced the worst country in the world, the hardest hit country in the world in terms of number of cases, in terms of deaths. But the other pandemic is, a half millennium old pandemic of colonization and genocide and slavery and racism, white supremacy, effectively. And the current movement, the current protest movement, around this. The work has never stopped, right? The resistance has never stopped, but is really bringing to light the harms that we do against all of us, but especially against people of color, especially against our Black community. And that that's hard. That is a painful reality that that is, unlike police violence, much better documented. We see in the numbers the increases in maternal mortality amongst Black versus white. We see the increases in heart disease related mortality among Blacks versus white. We see the increased vulnerability in terms of experiences of poverty across the life course in Black versus white. And it's intergenerational, right? It's not just that someone won the lottery and got born Black or got born white, but it's that comes from familial histories and community histories and national histories of systematically privileging white folks at every conceivable moment of economic, social, and political opportunity over folks of color, over the Indians and indigenous folks, and over Black folks especially. Yeah. So we're at this moment where we've got the masks and we've got stay at home and we've got a squandered opportunity to try and get to the place where we flatten the curve and brought it back down and get to test, trace, and isolate or quarantine. But we've also got this yearning that we're all feeling to end systematic institutionalized racism and to end colonization, to decolonize our society. And that neither work trumps the other. And in fact, they intersect. The policy, for example, here's a great example of how they intersect. The crisis care management guidelines, right? The crisis care guidelines that say, how do we prioritize? How do we ration? How do we triage our responses to folks who come in with severe COVID symptoms in our hospitals are predicated on treating the people who are healthiest. Well, who are the people who are healthiest? Well, they're likely to be the white and the affluent. So effectively, those kinds of policies are racist policies, right? Because they demand that the Black and the brown and the poor simply suck it up and die more, right? Be treated less.
I mean, we hear that from the president right now, implicitly, right, if not explicitly. And it's not just COVID, right? We saw that in the border situation. When I was talking, I think it was with KGW, they said, why are you calling them secret police? Don't you understand that this is the government? They have paperwork. I said, no, they don't. We are actually putting all of the lack of accountability on to Black and brown people in this country. And our government is not being held accountable for outcomes and not being held accountable for data and not being held accountable for expenditures that really kill people when it comes right down to it.
Well, there is a whole death cultish narrative among, I mean, some of them are very explicit. The governor of Texas has said some really...
Yeah, Lieutenant Governor of Texas.
Oh, I'm sorry, Lieutenant Governor.
Yeah,
no,
he's
has
far,
just
far right.
really explicitly said people should just be willing to die for the business.
Yeah, die for the herd.
It's okay. I'd be happy to die. Like it's very...
Yeah.
It kind of evokes in my mind a notion of people gathered around a table at midnight wearing red robes with a sacrificial dagger. It's gross and scary. Yeah.
Well, and I think that what we need to do is give people better options, right? Folks are desperate. Much of what we're seeing in the streets right now, I think, is an amplification of what was happening with the first Occupy, but now there's a greater intersectional perspective and understanding of the critical role of racism in all of this and white supremacy. And I really appreciate something that you've said to me and tried to hammer home. And I also appreciate you continuing to educate me, because we need leaders who are continually learning and trying to refocus and reorient the discourse around all public policy is public health policy. And before we go,
right.
and I'm going to say it one more time because this is how you do it to me, Sarah, all public policy is public health policy. What
That's
do you
right.
mean when you tell me that? What are you trying to say?
Yeah. So we are so invested in this individualistic or, kind of lens in this country that frequently you say health policy and people go straight to insurance and how can my doctor treat me? And that's important stuff. Certainly that's a kind of health policy, but immigration policy is health policy. Laws that give police 3 days after shooting someone to uh, sift through evidence and prepare before being charged or investigated. That's health policy, right? Uh, Street sweeps of folks who do not have houses during an infectious disease pandemic is public health policy. All of our policies are creating the society that we live in. And to bring it back to that point that I made at the beginning of this discussion, the health that our population has is a result of the choices that we make about how we are structuring our society. So education policy, health policy, loan policy, bank policy, health policy. It's all health policy.
And
And
what
so
you
what does
measure
that
is what
mean?
you'll get. Yeah.
And so what does that mean for us when we're thinking about, well, what should we be writing to put on a ballot, or how should we be advocating to our representatives, or whatever is, wherever we are making policy, and not even just in government but in institutions, in workplaces and in labor organizations. When we are making our decisions, what can we say about how this is going to affect health? That's what all policy is health policy means. It means that we have to be thinking about the health and well-being of people in all of our decision processes.
Well, I appreciate you for teaching me that. I appreciate your advice on how I can make my tomatoes grow faster and bigger. I appreciate you being a fantastic neighbor and educator. We are lucky to have you. Portland is lucky to have you, and I'm lucky to have you in my neighborhood. And thank you so much for joining us this morning to share your knowledge and your wisdom with the people who are viewing and the people who will be listening to this on our podcast.
Oh, well, you're very welcome, Sarah. Thanks.
All right. Have a wonderful day and weekend. Thank you, everyone. I hope you have a wonderful day and weekend too.